Hey guys, this is Dr. Sean again. Today we're going to be doing a video on lateral knee pain. There's a couple of reasons why somebody may be having lateral knee pain. One reason is they may be having what's called lateral compartment syndrome, where the meniscus on the outer aspect of the knee is wearing slim. So basically it's osteoarthritis, is where the cartilage on the outside of the knee is starting to degenerate. And so that'd be somebody more in their 50s or 60s starting out with. Another reason of lateral knee pain would be an LCL ligament sprain, so your lateral collateral ligament. And that is kind of rare. We'll see that sometimes in athletes, but it's much more common for somebody to tear their MCL or have a sprain on their MCL or medial collateral ligament than their LCL. The most common cause of lateral knee pain, though, is IT band syndrome, and that's what we're going to be focusing more with today. So research shows that 20%, more than 20% of injuries that somebody may have in their legs or the lower extremities is caused from IT band syndrome. So it's a very, very common cause of pain in the knee. It's most commonly found in people that are athletes, so runners, somebody who does repetitive, any sport where there's repetitive knee bending, so runners, basketball players, somebody who does a lot of hiking up and down hills, tennis, things of that nature. And I'll show you guys what the IT band looks like. So the IT band is this long fibrous band, okay? So if we're looking at the knee joint here, this is from the outer aspect. This is looking at the knee from the outer aspect. So looking at it at this side view, you've got this long tendon, okay? So it's actually a tendon. A tendon differs from a ligament in that a tendon attaches muscle to bone. A ligament attaches bone to bone, okay? So this tendon derives from two of our hip muscles. I'll show you another picture here. So again, right here is the IT band, okay? So it stems from a muscle called our gluteus maximus. So that's our really big butt muscle that we sit on every day. And then this one's kind of a funny name, our tensor fasciae latae. Almost sounds like you're ordering from Starbucks, right? So this muscle is right at the front of the hip. The gluteus maximus obviously is that big muscle that we sit on, okay? So those two muscles come together and they form this big long tendon on the outer aspect of our thigh and attaches to the outer aspect of our knee. So going again to this other picture here. So again, the IT band, and it attaches actually on our tibia, okay? So when we're doing sports where there's a lot of repetitive knee motion and this IT band gets really tight, it can cause rubbing on that tibia, okay? And usually at about 30 degrees of bend is where the individual would get a lot of pain, okay? Or that they get that soreness because it rubs right at the front of that tibia. Now, I said a lot of times it happens, we see it more in athletes, but this can be a problem also for somebody who's older and starting to get wearing down on the outer aspect of the knee, where that IT band can also get tight and you have a lot of scar tissue formation. So some of these exercises that I'm going to be showing you would also be beneficial for somebody who's having that lateral compartment syndrome as well. So the first exercise I'm going to show you guys is some stretching, all right? So I'm going to start off with a standing stretch for that IT band. I'm going to move my phone here. So let's say this is my affected side right here, okay? So this is the knee that we want to stretch. So what you're going to do is you're going to cross your other leg over that leg that you want to stretch, okay? And you're going to come up to a wall and you're just going to lean over, okay? And you should actually feel this mostly up in your hip, okay? You may also feel it down by your knee, but you want to mostly feel this up by your hip to make sure you're stretching the right area. Okay, so just like that, you would hold that for about 30 seconds and you would do multiple sets. Again, so you take your affected leg, the leg with the knee pain, on the outside of the wall, cross your inner leg over it, and you're just leaning over. So by stretching those hip muscles, we're indirectly helping the cause of what's causing that knee pain down here, okay? Move my phone back over here. The next stretch I'm going to show you is for your quadriceps, okay? So the IT band actually has attachments to our quadriceps and our hamstrings, okay? So by stretching the quadriceps, again, you're indirectly helping that tightness along the IT band. So let's say this is the knee that I'm having pain with. You're going to lie on your side. Grab your foot. Lean over, okay? Lie down on your side. And you're just bending that knee, bringing that heel towards your butt, okay? And you want about a mild to moderate stretch. You don't want an aggressive stretch. And while I'm holding the stretch, what I'm thinking about doing is I'm extending my hip back, okay? So I'm not just letting my knee come forward. I'm actually trying to actively extend my hip back. And I'm also thinking about as if my leg is like one of those Stretch Armstrong dolls, where I'm trying to actively lengthen my leg to the wall right this way, okay? So I'm thinking about telescoping my knee out towards that wall here. So I'm actively extending back and telescoping, but I'm trying to keep it to a mild to moderate intensity, okay? So the purpose of stretching is to lengthen connective tissue and muscles, not to tear it. So you don't want to aggressively hurt it because you can cause more inflammation and more knee pain. Now somebody with that lateral compartment syndrome, where they're having some degeneration on the outer aspect of that joint, this would probably hurt, so I probably would not recommend you doing this stretch. This would be more for somebody without that degenerative disease, joint disease in their knee, and who has more just IT band syndrome, okay? Okay, so the next exercise I'm going to show you guys is actually to strengthen the inner quad. So we got our vastus lateralis, that's the outer quad here, and then we got our vastus medialis, okay, and that's the inner quad here. Now what I tend to see in my patients with knee pain is that the outer quad tends to get really, really tight and strong, but this inner quad tends to be very weak. And I noticed that when we strengthen this inner quad muscle, that tends to resolve a lot of knee pain, or at least help to reduce the knee pain substantially. So what I'm going to do is an exercise to really facilitate this muscle. So we're going to put the ball between our legs, and the focus is on really maintaining that ball squeeze. So you want to see that deformation in the ball, okay? And you want to maintain that throughout the whole exercise. So let's say this is my affected knee. So I'm squeezing that ball, kicking that leg up, pausing for 5, 4, 3, 2, 1, and I'm slowly lowering down while I'm really maintaining that ball squeeze, okay? Now this exercise seems really simple, but it's actually quite challenging, and I think you might see on the video where my knee's shaking a little bit. Keeping that knee squeeze, or that ball squeeze, hold that for 5, 4, 3, 2, 1, and slowly back down while I'm maintaining that squeeze. What a lot of my patients will do is they keep that squeeze really good when they're lifting up, but then when they're bringing that leg down, they forget about it and they let go, and that makes it a lot easier. The whole point is to keep that ball squeeze the whole time, and you would do a set of 10 repetitions, and you can do that for 2 or 3 sets. Again, this exercise is going to be good for both somebody who's got that lateral compartment syndrome, where they got the degeneration on the lateral side of the knee, and for somebody with the IT band syndrome, okay? Again, if you do get pain with any of these exercises, please just don't do them, okay? Okay, so another common finding I find in my patients with knee pain, regardless if they have the arthritis in their knee or if they have IT band syndrome, or if they have both, is that they have weakness in their hips. So one thing we got to remember is the main function of our muscles, yes, they do help our joints move, but actually the main function of muscles is to absorb shock. Excuse me. So when we have really strong hip muscles, that helps to absorb the shock of when we're running or doing sports, so that instead of that shock being absorbed in our joints, it gets absorbed in the muscles, okay, so that we don't have that early onset degeneration of our joints. So next thing I'm going to show you is called side-lying hip abduction. So we're working on the hip muscles back here. So we're going to lay on our side, and we're going to bring this top leg back a little bit. So we're going to extend that hip back. And what I'm going to have you do is you're going to lift up, pause for a moment or two, and slowly back down. Up, and slowly back down. Now, what a lot of people like to do is they start bringing the leg forward this way, okay, and doing it. It makes it a lot easier, but the problem is you're not working that muscle that we really want to key in on for helping our knee. You want to keep that leg back so that we recruit the glute muscles. Pause for a moment or two and slowly back down. You would do a couple sets of 10 to 15 reps with that. One thing that I find that's really helpful too for that lateral knee pain, especially for the IT band, is taking a Dixie cup, filling it with water, okay? You put the Dixie cup with water in the freezer, let that water transform to ice, pull it out of the freezer, tear the rim of the Dixie cup off, and where the side where the ice is exposed, you start massaging along that IT band tendon, okay? So right where the IT band tendon is, so that's going to be, where it inserts is right below the kneecap, right on the lateral condyle of the tibia. So this is our tibial bone, here's our femur, right below the patella where that kneecap is. You're going to feel a little ridge, and that's where the IT band inserts, okay? So you would use that ice cup, or that Dixie cup that's turned to water, or ice, and massage along there for about 5 minutes or until the area of your skin starts getting numb, okay? So that should be 5 minutes or less, and then you stop. And you can do that a couple times a day to bring down the inflammation. And that's gonna be a really big help so that you get less of that pain when you're doing your sport. All right, guys, I think that's gonna be it for today's video. If you have any questions, please leave your comments on Facebook or Instagram, or give us a call at Hilton Med Physical Therapy. We'd love to hear from you. Thanks again for watching, and we'll see you next week, okay?